Keeping track of your health through wearable devices. Can eating chocolate be good for you? And omega-3 fatty acids and heart health. This is Carolina's Healthcare System Network News. So, you have one of those health tracker gizmos you wear on your wrist, and there you are collecting and measuring all sorts of personal data. You might be wondering, is it worth the money I paid for it? And do I really know how to get the most effective use out of it?
It's an interesting mix of technology and fashion and personal preference. If you intend to use it in a way that engages you in your health and in your wellness activities, then it's certainly worth what you paid for it. Many people who have incorporated it into their life and made the use of that activity tracker a habit have found that it really has paid dividends in terms of engaging them. Beyond that, I think the most important thing is really to make it technically simple. You don't want to make it so difficult that it becomes a barrier or a challenge. For most people, if what they're really trying to do is become less sedentary or more active, starting simple without a million different features makes sense. But if you have a specific need, for example, you're a runner or you have a specific sleep concern, or you want to track your heart rate for some reason, then you want to obviously look at the feature set and make certain that it matches with what you're trying to accomplish.
And if you have a chronic condition like diabetes or heart disease, these wearables can make doctor visits more efficient and insightful for both you and your healthcare provider.
It can really elevate the level of conversation and the level of engagement that people have in that conversation. Then it really does help to influence behavior, because now you've got data, which drives insights, which drives behavior. Data in and of itself isn't the magic. The magic is the insights and the behavior change that comes from it.
And the takeaway?
Start small and keep it simple.
Chocolate lovers, take heart. You may have a lower risk for heart disease and stroke. Can this actually be true, you ask? Well, according to a recent study, eating up to 100 grams of chocolate, that's a little more than 2 regular-sized candy bars, every day, is linked to lowered heart disease and stroke risk. Or is it?
I can't really say that it does at this point, other than a feeling of well-being that we all have. I like chocolate too, but right now I don't think that this study is definitive to the point where we should adjust our diet to include chocolate every day.
So, before you go out and buy up a year's supply of the stuff, you need to know that this was just an observational study, meaning a group of individuals were observed and certain results were measured, and no attempt was made to affect those results. So, no definitive conclusions about cause and effect could be drawn. And there is the issue of calories and other serious complications from eating those chocolate calories.
Simply stated, the risks of eating too much chocolate are weight gain, and certainly the risk of diabetes, or if you're diabetic, of raising your blood sugar and having problems with that as well. Certainly with weight gain, then that leads to raising your blood pressure, strain on the heart, and cardiovascular events are all increased by high blood pressure, including heart attack and stroke.
And you thought you could get away clean with this one. Oh well, nobody said it would be easy. But this may be an easier way to ward off heart disease: eating foods rich in omega-3 fatty acids. A recent worldwide study involving over 45,000 participants found that people who ate foods rich in these acids had about a 10% lower risk of fatal heart attacks. And what foods contain the most omega-3 fatty acids? The major source, of course, is fish. Fatty fishes like salmon, trout, anchovies, sardines, and herring. They have the highest amounts, but other less fatty fishes contain them too. Fish also provide specific proteins such as vitamin D, selenium, and other minerals. Plant-based omega-3s are found in walnuts, flaxseed and canola oils, and some herbs and spices such as fresh basil, dried oregano, marjoram and tarragon, and ground cloves. The study provides the most comprehensive picture to date of how omega-3s may influence heart disease and lend support to the importance of including them in a healthy diet. So, the fish may not be as sweet as chocolate, but you'll be healthier and live longer.